How does radical nephrectomy surgery work? Imagine a surgery designed to remove a whole kidney to fight cancer. That's what a radical nephrectomy is. It's a common treatment for kidney cancer when the tumor is large or has spread. The goal is to remove the cancer completely while preserving the other kidney's health. The procedure can be done in different ways, depending on the patient's situation and the surgeon's expertise. The most common methods are open surgery, laparoscopic surgery, and robotic-assisted laparoscopic surgery. All of these requiring general anesthesia, meaning the patient is fully asleep during the operation, which usually lasts about 3 to 4 hours. In an open radical nephrectomy, the surgeon makes a large cut, usually below or over the lowest rib, to access the kidney directly. They carefully cut through tissues to reach the kidney, then identify and control the blood vessels that supply the kidney. This involves tying off the renal artery and vein to prevent bleeding. Once the blood flow is stopped, the surgeon removes the entire kidney, along with the ureter, which is the tube that connects the kidney to the bladder. They also remove surrounding fatty tissue called perinephric fat, nearby lymph nodes to check for cancer spread, and sometimes the adrenal gland if it's involved or very close to the tumor. The surgeon takes special care to avoid damaging nearby organs like the liver, spleen, or intestines. In laparoscopic or robotic-assisted surgeries, the process is similar but less invasive. The surgeon makes 3 or 4 tiny cuts in the abdomen, each less than 1 centimeter long. Through these small openings, they insert a camera called a laparoscope, which gives a magnified view of the inside of the abdomen. Using tiny instruments, the surgeon carefully dissects the kidney away from surrounding organs. The blood vessels are clipped and divided to control bleeding. The kidney, along with the tumor and some surrounding tissue, is placed inside a special plastic bag to prevent spreading cancer cells. The entire kidney is then removed through one of the small incisions, which is slightly enlarged if needed. The small cuts are closed with stitches or staples, leaving minimal scarring. The key steps in the surgery include carefully dissecting and tying off the blood vessels, removing the entire kidney with the tumor and surrounding fat, and sometimes removing nearby lymph nodes or the adrenal gland if necessary. The surgeon's goal is to remove all cancerous tissue while protecting other organs and blood vessels. After surgery, patients are monitored closely for signs of bleeding, kidney function, and recovery progress. Recovery time tends to be faster with laparoscopic or robotic surgery because these methods cause less pain and trauma. Radical nephrectomy is an effective way to remove kidney cancer, especially when the tumor is large or has spread locally. It allows doctors to control the disease and gives the patient a good chance for long-term health. Since only one kidney is removed, the remaining kidney usually takes over the job of filtering blood. However, patients need ongoing checkups to monitor their kidney function and watch for any signs of cancer returning. Always remember, the best approach depends on each individual's health and the specifics of their cancer. Consulting with a healthcare professional is essential to determine the most suitable treatment plan.